So we can start the talk today.
Yeah.
So today we're going to share the products. It's called FVF. FVF is for gut health and also blood sugar regulation. The reason we focus so much on the blood sugar control is because the high sugar is a lot of problems like for stroke and also for the eyesight problem, like even we call it cataract, glaucoma, and also the problem with the diabetic eyes. So these are the problems all due to this high sugar. So as an end result, they will form all kinds of disease from head to toe. Okay, so we will share the first page. What is glycation? Glycation actually is just like sugar binding with protein. And everyone knows the protein is all over the body. So we just made an example that how sugar binding with collagen and the elastin protein. So we know how does the wrinkle form and why the skin sagging. Look at the first picture. Okay, it's a normal skin with it's a normal skin with the normal layers. We look at the bottom of the skin. So the underneath tissue is actually we call it collagen and the elastin protein to support the skin, so make the skin look fuller and also more support, more elastic, and more radiance. So it's underneath the skin, the bottom layer near the near the protein level, there are a lot of micro blood vessels. So these blood vessels, once we have a high sugar, so the sugar will bind together with the protein, which are the collagen and the elastin protein. So once the protein bind together with the sugar, they will cause a skin damage. So the skin start to sag, and that's how the wrinkles form. And the once sugar binding with protein, and these products is called AGEs. The AGEs will last for many years, and it's very unlikely you can reverse it. So that's how once the wrinkle form and once the skin start to sag and almost irreversible. So that's why we see why when age is catching up, some people's skin still can look a little bit better, not so bad, but some people's can have a very sag skin and also a lot of wrinkles all over the place. So the main reason to cause a skin damage and to have this kind of result is glycation. That's why now the young people are so much focused on the no sugar diet. But let's say in Philippines, in Malaysia, people still taking a lot of high sugar drinks, which is very harmful. And now I'm in China, all the young fellows, once they go to the coffee shop, they always say no sugar, like even not like before. So people pay so much attention because they want their skin look nice. They don't want the skin to age so fast. And like the second one, the very important material in the ligaments, which is the ligament is the one to connect the bones together. So the ligaments, the main content of a ligament, also collagen and elastin protein. So once the blood sugar is high, they will also damage the ligaments. Look at the corner one. We have a very good case study. I like it because they demonstrate the damaged sugar, how sugar damages the ligaments. Like the one, look, yellow, a little bit yellowish one is actually the ligaments without high sugar. They put this cause tail ligaments in one of the container. Then it contains very natural substance to support the ligaments so they can last long time. And the other one is the one who has a high sugar content. After 28 days, you can see the ligaments looks totally different in color, in shape, also in the feel when you look at this. So this is also a very good example for glycation, because once your body blood sugar is high, it will damage the ligaments. So end up with all kinds of joint pain, like now a lot of people having knee pain, shoulder pain, finger stiff, and back pain, a lot of bone issues, actually all related to this sugar. Okay, is how high sugar damage the blood vessels. So in our body, there are big vessels and also small vessels. And we have artery, we have also veins. Artery is important because inside the artery, the blood carry oxygens. And the big artery is like say is in our trunk, like in the abdomen, and also like common aortic artery, which is the largest artery in our stomach. And you can also feel the common carotid artery, which is the main support to the brain. But our body is not mainly the large arteries. There are many, many tiny arteries and also veins all over the place. Like in the brain, there are a lot of small arteries in the brain tissue. Once, if there's so much sugar floating inside these small micro arteries, so what it cause? It causes damage. So that's why the skin have, in the beginning, they have a mild stroke, and also the skin in the brain, they have a mild stroke, and also got ischemic changes. I mean, the blood supply for the certain brain tissue is not enough. Only when this thing accumulate or slightly larger artery broke, then we cause a big stroke or massive stroke. But the small stroke always happen during the time people don't even realize there is a small, like a minor stroke. And if the minor arteries appears in the eye, so they also damage the eye. That's why all the eye problems start with high sugar, and also affect the heart. That's why people go for the heart bypass, or there's a stenting. And this high sugar also affect the liver. That's the reason cause a lot of people having non-alcoholic fatty liver is because there's so much sugar. Body don't know what to do with the high sugar. They transfer the sugar into fat and store in the liver. That's how those people do not drink alcohol, still can have fatty liver. And this fatty liver, after a while, the liver also cannot stand so much fat in the liver. Liver is a detox organ. So the liver will transfer this fat into the blood vessels. That's how we cause a high cholesterol and also LDL. So this is how sugar related to the liver problems. And once the liver is so fatty, they will damage the liver function. That's hence it will cause liver function change. Actually, these are the things all related. And the small vessels problem, also the inflammation because of a high sugar, we will damage the kidneys. We have a lot of people, and people is getting younger and younger who has a kidney problem nowadays. And our kidney, because kidney got a lot of blood vessels, especially arteries. So if these arteries get damaged, people will start to have a protein in the urine. And after a while, if the blood test change, doctor will tell the patient, say, hey, you have to go for dialysis, or even worse scenario, kidney transplant. So, and we also know the high sugar will cause people like diabetic, high sugar people, once they got a wound or the infection at the lower limb, and a lot of cases get amputated. They can just chop the legs. We call it amputation. So these are the things actually. There's a lot of impact, like what I say, from head to toe. And in the meantime, the high sugar cause the blood vessels inflame, and also the vessel walls getting harder. So once the blood vessel wall getting harder, what they're going to cause? High blood pressure. That's why in the medicine, once people have a high blood pressure, it's unlikely to be cured. That's people always say, once you start to take high blood medicine, then it's unlikely you're going to stop the medication, because the moment you stop taking the medication, the blood pressure will go up. Why so? Because we never sought the bottom cause of high blood pressure. So in order not to get these other diseases, that from head, the stroke, eye problems, and the heart problem, liver problem, and also the kidney problem, we must control our sugar, even the high blood pressure. And these years, even the WHO also spent so much time and concern on the high sugar. And one of the German professor, he found out that cancer cell like sugar. I think we all know there's a test called PET-CT. That means if somebody got cancer, immediately doctor will not do any surgery or chemo or radiotherapy. They will ask patient to go for a PET-CT. The PET-CT, we also call it staging test. So the doctor need to know whether the cancer has spread to other places, whether this is not primary, it might be a major one somewhere. So the PET-CT use a dye, we call it, to inject into the blood and show, under the CT scan, we show whether there's other lesions all over the body. So the dye we inject into the blood vessel is the main substance and the material is glucose. So the moment you inject the glucose into the blood flow, then the cancer cell immediately grab the glucose. Then we use we call it color or something to trigger to follow. So the doctor will see, certain area the cancer has actually grabbed so much glucose. Hence, they will show on the CT scan. So this is called PET-CT scan. So for so much, we have talked about the skin sagging, wrinkles form, and the stroke, eye problems, and heart problems, liver problems, kidney problems, even the wound injury, or a lot of people lost a leg or even lost both legs. So this is the initial reason is all high sugar. And in UK, actually, the UK Cancer Society has mentioned that if, like, say, people is overweight, once people is overweight, because fat cell carries only two things. One is hormone, another is, we call it fat soluble toxin. So once people is overweight, there's so many cancers is related to overweight. So in UK Cancer Society, they educate people need to lose weight. So hence they can also stay away from those high risk cancer factors. This is the one actually just now we already mentioned. This doctor found, this is actually Dr. Old Warburg. He has found how cancer cell grab glucose and how glucose feed the cancer cell. So he also win the Nobel Prize because he found that this is how the metabolism or tumor and how they call that respiration of cells. Then is how cells make use of glucose to produce energy. And the products, the main ingredient in these products is called purple okra. Okay, we all know about green okra, and seldom people know about the purple okra. Actually, The okra color is a little bit like not really purple, it's a maroon color. And this purple okra can grow very tall, and the okra itself, it doesn't taste nice because it's so much fiber. So what actually we use the seed, the purple okra seed extract. So with a special technology, and the Singapore, actually this technology under Singapore NUS group of doctors, they have studied and also found the extract of this purple okra seed have such a function, anti-sugar, can help you to reduce sugar. In the FVF one sachet, there are about 150 milligram of purple okra seed extracts is equals to 1 tablet of like metformin, like diabetic people is taking for every day. So we use this technology. How come the purple okra seed can actually block the, we call that, the sugar? Because now the main thing like increase or raise up our body sugar is carbohydrate, especially rice, noodle, and also the like bread, and also cake, and also biscuits, so pizza, spaghetti. So this is all the food, the main food we are taking. Actually, we call them processed food. So processed food, that means they already lost a lot of essential nutrients in the food itself. It has been polished, has been processed, so the food contains nothing but sugar. So like you take rice or porridge, those kind of things, immediately the sugar will raise up. So because you cannot stop people from eating this become not only in Singapore, in Malaysia, in Philippines, is all over the world. So how come people nowadays getting like diabetes so often, and the age is getting younger and younger? Is because the food we take. So the FVF main ingredients have such a function. Like say the carbohydrate, after you take carbohydrate, they will end up become glucose, then become energy. So from the carbohydrate for glucose, in this pathway, we need one enzyme called alpha amylase. So without the alpha amylase, the carbohydrate won't become glucose. So this purple okra seed extract can block the alpha amylase. Hence, the carbohydrate you take 100% become sugar. So we will stop sugar from the beginning. And in the meantime, the purple okra seed also have a lot of antioxidant benefits. And also there's a lot of special proteins, essential minerals, which is very good for the intestine to heal, and also good for bowel to pass out. So next page we talk about yes, Singapore, this NUS have already published their paper in one of the main paper about their results, research, and what are the technique, how they produce, and how effect of these products. We work with this Singapore NUS team. Then the next page we talk about constipation. I think constipation we don't need to talk much. Everybody have more or less the constipation histories. Why so? Because our intestine, our intestine have a lot of we call it second brain. Actually, I think very soon, with the amount of research we do, we will notice that the intestine actually may be the main brain, because a lot of things happens from there. And it's a digestion function and the absorption function. I mean, all the nutrients get absorbed from the small intestine, and all the food we eat, whatever we eat, they will be processed and digest into amino acid, and energy to be used by our body. So the intestine is the most thing is a very important immune cells. Then because 70% of the body immune system is allocated at the large intestine. So this intestine is very important. If the intestine area is not clean, there's a lot of toxin and germs and bacterial virus, and also the environment is not very pleasant. So the intestine, the immune system will be keep fighting with all the bacteria. Hence, the body immune system will drop. So if they all fighting in the intestine, so we got energy to fight with whatever virus or the bacteria attack to our body. So there's the inner lining in the large intestine, which will be generated in every 3 to 5 days. That means because it's so toxic, so the intestine inner wall cells will get changed in about 3 to 5 days. Because the intestine cells, to do this thing, they need a lot of energy. So where the energy come from? The energy is from fiber. That's why we need dietary fibers, because if we do not take enough dietary fibers, whether it's water-soluble or insoluble fibers, these fibers our body cannot absorb. But the intestine, those bacterial like probiotics, the bacterial, especially the probiotic, need fiber to ferment, to produce the short-chain fatty acid. Is an energy for the intestine cell to do such things, to get energy, to change. So this thing is ongoing doing. If we do not feed the probiotics, those good bacteria, good food, they cannot produce energy. That's why the intestine wall cannot get changed and renewed. Hence, a lot of people have irritated bowel syndromes, reflux in the stomach, and also sensitive food intolerance. This is all associated with the inner lumen of the intestine. So another picture shows the intestine under the gastroscope and the colonoscope. So the first picture shows like a normal mucus. You can see the vessel walls and the mucous lining is very clean, transparent. And the other one have a big ulcer. This ulcer looks familiar because just like our mouth ulcer. And the other one, like a little bit blurred, they got red spots all over the place. This is a chronic cholecystitis, which is an intestinal inflammation. And the other one is a colon cancer. So what is FVF drink? Actually, the FVF drink has been formulated for, I think, since more than 10 years ago, and by the team of leading professors. Actually, a lot of the doctors itself, they also have these kind of problems. So we have a team of professor who has spent so much time and effort in the formulation. And this natural formula is solved to the worst intestinal and glucose problems. So health intestinal tract and a blood glucose level, it is very good for people if you want to live healthy and live longer. If you have a high sugar, definitely cannot. And if you have intestinal problem, still, yes, no, cannot live a better life. So benefits of every sugar FVF drink, because it's a natural, it's a food ingredients, no dependence, and it's very ideal for the probiotics. We produce not only probiotics, but probiotics, also prebiotics. Why prebiotic? Probiotic is a good bacteria. Prebiotic is the food for the good bacteria to take. Nowadays, there's a lot of products for probiotic products. So sometimes people still very uncertain because we don't really know what are the bacteria inside our intestine. Hence, You don't know whether this probiotic is suitable for you, and whether this bacterial strain is good for you, and how much you take will be essential, will be good for you. So nowadays people have also shifted to prebiotics. That means we give the probiotic food, so the bacteria will actually grow themselves, to develop themselves. And this FVF drink is very natural, gentle, and won't cause like irritate bowel, like stomach cramp. The result happens in about 8 to 15 hours. That means because the food will get digested in the stomach for 2 to 4 hours. Then from the stomach, move to small intestine, 4 to 6 hours. And when the food transfer to the large intestine will be about 10 hours. Hence, this FVF designed according to the natural process of our food. It takes about 8 to 15 hours, like myself, maybe more than about 15 hours, because I have a very long intestine. For average people, it's 8 to 15 hours. So these products, low sugar, no added sugar, no fat or trans fat. Another thing we talk about FVF drink. So the Health 101 research and development team is from Germany, US, Israel, and Singapore. And it's the most ideal formula for bowel management and also blood sugar management in a global market today, because this product is selling very well, not only in Singapore, but in Malaysia, in China, and we are going to move to Philippines